Hello everyone, this is Dr. Krishan. I am a resident surgeon in Delhi. Besides this, I am a NEET UG and PG faculty and mentor. I am a medpreneur and CEO in many companies like Burgeon that deals with the revolutionizing school educations. Then by the one company by the name of the Medx then publishers. And after this, I am also a North India chief in an NGO that goes by the name of the Dahij. And also I am a academic in charge and the governing council member in the Federation of All India Medical Association. This is one topic I thought to make video in the initial part of the lockdown due to some of my experience, but due to my busy schedule I couldn't make, and today I thought to I should sit down and make. And this video is basically for the drug company, pharma company, laboratory owners, all the person who own the laboratory, and that may be the pathological or a radiological laboratory, and also the hearing aid and audiometry centers on as this video is mainly for those service provider who cater to the ENT hospital or who cater to the ENT department in the government tertiary care centers, government or private, like that. So coming to the basically thought the tips which I gave, these are useful to the pharma companies who can train their medical representatives appropriately. As being a resident surgeon in the department of the ENT, I feel that the medical representatives are not properly trained. Due to this, many times our time also get wasted, and also they are not efficient. So they put more time, they invest more time compared to what they would have invested if they would have been properly trained. So there are few tips which even medical representatives or the pharma companies can adapt in the training of the medical representatives, and that will be helpful for them. And also medical representatives can inculcate these tips in themselves, and that will be helpful in their increasing their sales or in making the whole process efficient, because everyone wants that, like that. So coming to the medical representatives, what once on a MR call, medical representatives comes to our OPD and they start telling about some new drugs and like that. What else I would suggest you, thought there are minor differences in how you should be you can be the more efficient in the government setup and private setup, because the principles of the practice in both these two domain of the practice is slightly different. So few basic things I would like to tell you people, that for example, if we are describing a drug, if our MR is describing the drug, they should try to finish that particular drug in 2.5 minutes, which you should plan, you should practice your schedule. If you are a beginner, or even if you have been to different centers in orienting the practitioners about some of your drugs and all, you are experienced one, you should try to I feel that MR are not interested in describing everything about drug. Many times you should, in every call, you should actually orient the doctor, because the number of times you will repeat, the number of times we will remember, and any practitioner will remember, and it will be able to means what. So many times we are not means we should it should be in our subconscious mind when to prescribe which of your medicines to our patients. So like that, you have to repeat the same medicine, try to practice it more. For example, under these headings, any drug should be discussed. First start with your name of the drug, then doses, what doses, any pediatric doses, like that, then mechanism of its action and how it is different from its other competitor available in the market. Then it is approved by FDA or DGCI for which pathology. Basically every drug can't be given in every pathology, like that means but the DGCI approve one drug for one particular pathology. You should tell to the physicians, you should tell to the surgeons in OPD that this drug is for basically for this, like that. And then what is the price per tablet? What I ask from many of the medical representatives who visit my OPD, that what is the price per tablet or price per bottle of the syrup, like that. And then any supportive study, you should give, either you can give the hard copy, or better you should send the PDF of that study to your doctor whom you visit in the form of PDF on social media, on WhatsApp or mail, like that. So these are the basic things. You can improve it like that. You can improve it more effectively. You can add more. Every doctor has something different to ask from you. And at the end, you should also say like that, "Okay, sir, anything you want to ask about this drug." Then this will give a better impression of yourself on that doctor, like that. And even if you are updating about your brands, your products to the doctor in daily before morning OPD on WhatsApp. If you are not, actually every MR can't visit every hospital every day, so what most of the company do, MR visit us twice in a week or once in a week, and on other days of our OPD, they basically they provide us updates on WhatsApp or social media, and basically use technology effectively, like that. And then this is all about the pharmaceuticals. Basically, coming to the hearing aid and audiometry test. Hearing aid and audiometry test, in my OPD, many people come for their promoting their audiometry centers and all. What I feel, they don't effectively, means you should discuss everything with the doctor, because in between, doctors are free. If he means permit you can discuss about it. You should bring different types of hearing aid which your centers provide, and discuss every pros and cons of everything. Then there will be better patient selection, and ultimately your workload will also means lessen, because primarily doctor will discuss, means will do product selection at his level only, then you after counseling patients or in discussion with the patient, you can bring different behind the ear, in the canal, like that, and other types of hearing aid, their pros, cons, their approximately MRP and all that, doctors can counsel and all. And audiometer, similarly with the audiometry test, the different tests, different therapies the audiometer centers provide, like that. You can discuss, you can even tell the doctors about the approximately MRP of the approx MRP of the different diagnostic test and different hearing aid. You should discuss. Actually, you should bring in the models, or you should bring the hearing aid, and you should show the doctors in their OPD. That will be more effective. Coming to investigations, there are basically two types of investigation: radiological, and second one is pathological. So you should discuss that what is the price of the investigations, and by which method you do different tests, like that. There are different there are 3-part machine, 5-part machine, 7-part machine. You should tell more about the your lab. And moreover, I would advise you people, especially hearing aid audiometry centers and laboratory, pathological and radiological laboratory, request surgeons and physicians to visit your centers sometimes, once in a while, to see what all varieties we offer, and because that will basically increase the confidence of the surgeon in your centers, and or a physician in your centers, and consequently your market will also improve. What I want to achieve with this video or with these tips, that basically the patient management will improve manifold, because we as a surgeons, as a physician, and you as a owner of the lab or the medical representative, we all are basically COVID warrior. We want to work COVID warrior or warrior for the making our patient healthy. Basically, we want to provide them with the best possible thing, best possible system. Consequently, our country, our whole world will be healthy. So I hope this video helps you. For any query, you are free to discuss. If you want to, why I thought to make this video, because I have worked as a CEO for last 7-8 years. I feel that there is a need to train everyone, and effective training make best employees, like that. So I would like to, if you have any query, I would like to message me on WhatsApp. My WhatsApp number is in the comment section of this video, and I work in different domain. If you have anything related with the different aspects in which I work, you are free to contact me. I will suggest you preferably contact me on WhatsApp. Thank you.